Hey, y'all, welcome back to Lighthouse News Team Report. This is my second, what do you call it, report segment for the day. And just bring up the screen and we'll get to the news. All righty. This is an exclusive report. It is coming from the border report. It is an Omicron subvariant discovered in South Texas border county. Excuse me. Over 20,000 COVID 19 cases confirmed since December 23rd, including 10 cases of the Omicron variant. Regional testing facility to open in RGV next week. This is in Hidalgo County. Okay, McAllen, Texas. Health officials say they've discovered a subvariant of the Omicron variant of COVID 19 among 5 new cases in the South Texas county of Hidalgo, meaning the virus has mutated again. In the exclusive interview on Thursday, Hidalgo County Health and Human Services Chief Administrator Officer Waldo Eddie Olivares told Border Report that there are now over 20,000 cases of coronavirus detected within this border county since December 23rd, including 10 cases of the Omicron variant. Among the 10 cases of Omicron in Hidalgo County, scientists have discovered a mutated new form, which is subvariant. Oliveros says the subvariant detected, however, does not necessarily mean the virus is worse than earlier forms. We have 10 confirmed cases of Omicron, but we have our first confirmed subvariant of Omicron. Is it a more serious illness? No, just a different molecular structure, he said via Zoom interview. The exposure case is so high along the border in the Rio Grande Valley that the state and health FEMA officials will open a regional drive-through testing site next Wednesday at the Edinburgh Municipal Park in Edinburgh, Texas. There have been at least 2,000 new cases of coronavirus in Hidalgo County just since Monday, he said. Oliveros says scientists have already identified over 30 different variants of the coronavirus strain, including the Delta and the Omicron forms. And he said they are constantly working to discover more, as well as the subvariants of each strain. Several news reports include those from India have identified at least 3 subvariants of the Omicron strain of COVID 19, and that was reported on the Times of India, calls the subvariants siblings of Omicron, third of which was detected in England on December 3rd. Okay, then here they're getting into over the 2,000 COVID 19 cases confirmed since December 23rd in South Texas border county. Oliver said not every person tested for coronavirus has their sample sent to evaluate its strain. Testing for Omicron strain and other variants can only be done at state level by the Texas Department of State Health Services or by the Center of Disease Control and Prevention. The process is quite intense and involves specialized equipment and staff. It includes the study of over 300 different segmentations of the virus sample. Instead, only random sampling and tests are sent by hospitals and big box pharmacies to be evaluated. Test results could take upwards of 3 weeks for local officials to receive results. In the meantime, there has been significant community spread, which is what appears to be happening on the South Texas Mexico border. Knowing that the Omicron variant is highly infectious and fast spreading, Oliveros said he and other health officials in Hidalgo County strongly believe that the high rates of new cases of the Omicron strain, but they don't have conclusive results back in yet. Other border communities are reporting a significant spike in cases, like Tijuana, Mexico, with a 74% rate. Mother Nature is very powerful. Mother Nature is going to win in the end, Oliveira said. Viruses are part of Mother Nature. Viruses adapt and change. A virus is the most simple form of life form. It is designed to multiply and feed. It's going to adapt to its food source, human, and it's going to adapt to growing spread. Though I said that TDSHS and the Texas Department of Emergency Management is working with the University of Texas and its affiliate campuses to launch a regional coronavirus testing site in the Rio Grande Valley. Said he hopes the site will be up and running for at least 21 days, during which time all tests will be free. The site will offer free tests, which he says have become very hard to come by. Going to be something to help us a lot, Oliveira said. We are very excited about having that FEMA TDEM test site being operational next week. So as the pressure builds to have these people trying to enter and just to visit, go shopping, try to find a new life in America and all that, yeah, you're seeing what we're talking about. We're getting a lot of exposure to these variants of what's being spread. So now I'm trying to find the next part. Okay, we're going to go to our second report for this segment before I close it out. Okay, part two, hundreds of migrants in isolation after testing positive for COVID-19 at various ICE facilities. Yeah, that means they're already in the U.S. These are the ones that didn't get their notifications sent back to Mexico to wait for their trial date. These ones are actually been able to be brought into the U.S. and they're being processed while around the states. Here in San Diego, this is being reported by Border Report again. COVID-19 outbreaks have again hit immigration detention facilities, where hundreds of immigration and customs enforcement detainees are currently in isolation. According to the ICE website, more than 22,000 migrants are in ICE custody, and almost 1,800 are currently isolated after testing positive for COVID-19. The outbreaks in isolation are taking place all over the country. Now, just got to type in and look for ICE facilities or detention facilities across the U.S. You can find where they're all at. Okay, the record number of daily COVID-19 cases reported in Baja California. In San Antonio, 190 detainees are being isolated at the Karnes County Residential Center. It's 175 at the La Palma Correctional Facility in Phoenix, and New Orleans at the Adams County Correctional Center. It's 107. At the Old Main Mesa Detention Center in San Diego, which is operated by the Tennessee-based Core Civic, it's 79 detainees in isolation. It's horrible that there should be anyone detained, especially during a pandemic, where there is no way to maintain social distancing, said Pedro Rios of the American Friends Service Committee. What we're seeing is that ICE and the private companies they hire to detain people do not provide them with the adequate equipment in order to avoid falling ill to this horrendous disease. Rios and his migrant advocacy group vehemently opposed the incarceration of most people, especially immigrants, during the current COVID-19 pandemic. And just the opinion from this news broadcaster, can you tell that he is a liberal? The organization is a liberal one. Yeah, they're sick. They're bringing it in. Go ahead, just spray them around the country to get everybody else sick. Now, why don't they go back to the way that they're supposed to do it when they freaking first set up the Border Patrol? And if you have anything you don't come into, you're cleared. Yeah, go back to old school. Protect the American public before the freaking rights of somebody who doesn't have rights in this country. They may have human rights, but the human rights aren't oversee the safety and human rights of the American public. Well, that's just my perspective on it, and they cannot wrap themselves around that. The ICE is there to protect the people of the United States and the country, not the people from another country claiming, without any proof, that they need to be in our country. Because until their court date and they can prove it to a judge, they have no warrant to actually be in this country. Look up on the laws and stuff, and you'll understand what I'm talking about. I'm just trying to bring it down to the basic stem of it all. It's not realistic that the core civics should be expected to take care of anyone, and so to consider during the pandemic they would be able to take care of anyone. It's just not reasonable, Rios says. But a core civic representative, Ryan Justin, responded in a statement saying that staff at the Otay Mesa Detention Center are committed to the health and safety of every individual in their care. This commitment is shared with our government partners who hold our facilities accountable to the highest standards with on-site full-time staff to monitor our compliance. Justice said in a statement, patients with chronic health conditions are treated and regularly monitored by facility medical staff. All detainees and inmates have daily access to sign up for medical care. Our clinic is staffed with licensed credentialed doctors, nurses, and mental health professionals who contractually meet the highest standards of care. Core Civic also maintains several accreditations from national recognized industry leaders such as American Correctional Association, National Commission on Correctional Health Care, and Joint Commission on Accreditation of Healthcare Organizations, which assures we meet the highest standards for healthcare delivery. For Rios, the best course of action would be to let detainees go. See what I'm saying about the liberals? Oh, just let them go. They're sick. Let them spread it. You know, if they set if they set free, then they likely would be giving them a hearing where they would go have to present their cases. Most of them who would want to appear because they have active asylum cases or claims they would want to be heard in front of an immigration judge. Rios says, yeah, they want to, but half of them don't even freaking show up because half of them aren't even getting lawyers like they need to. ICE also issued a statement saying ICE is working closely with the Department of Homeland Security and other federal, state, and local agencies to facilitate a speedy, whole, and government response in confronting coronavirus disease 2019 or COVID-19, keeping everyone safe and helping detect and slow the spread of the virus. To keep the public, media, and family members of those in custody and other stakeholders informed, we will update this site frequently during the extremely fluid situation. So, as you see, the liberal organization is really pushed it politically that, the rights of immigrant, because they're saying they need asylum. Majority of them just can't find a job. They live in a violent country. And if you actually look at it, we live in a violent country here also, but we have laws, and they're trying to get around the laws as everybody else can freaking see with a common sense core. I know there's people that will not agree with me, but you're not in the middle of all this like I am. I've worked on the side of Homeland Security before and for the federal government, and I sort of understand the little process a little bit better than most people who just read 5 minutes and listen to somebody claiming that everybody should have the same rights in every country. Well, they should, but go fix all the other countries first. Just don't come over here and expect us to take care of you and everything else, and because nothing gets done in all the other countries. Fix your own country. Well, sorry going on the rant at the end. I usually don't do that, but this is sickening when it's a threat to the American public in our country that we live in. I'm sorry they're going through stuff. I'm not trying to be heartless, but in the long run, suck it up, buttercup. You wait on the other side and you wait until you get your court date and you get what you roll. Alrighty. Well, thank you for checking it out. Thank you for putting up with my opinion. My opinion is only mine. It does not is not what do you call it? Does not mean that the whole news team agrees with my opinion whatsoever. There's other ways to help these people versus just letting them in and affect everybody. All right. And as always, like I said, tell your loved ones you love them because you know what's going to happen in 5 minutes or 24 hours. I'll catch you on the next stream of Lighthouse News Team. Y'all have a good day.